Hi, everyone. Welcome to another episode at the Scrub Guru. As me and Dr. Krishna expand horizons of understanding neurosciences, neurosurgery, and like we recently discussed about the brain as well as some common neurological conditions, we will deep dive into some more topics today, and I'm sure all of you will enjoy. Thank you, Chief, for coming again on this.
Welcome anytime. Pleasure of mine. Yours.
Right, Chief. So let's continue our discussion where we left it the last time. Uh, let's talk about uh, some very important and common things that most people are aware and also maybe families face.
You mean paralysis?
Exactly. So let's talk about stroke. So, what is stroke?
Well, I started off telling it paralysis. People identify paralysis and stroke as one disease. Yes, in a way, most strokes are identified as paralysis.
Hmm.
But in the strict sense, paralysis just means a part of the body controlled by the brain is not working. Maybe it's a arm or a limb, that paralysis of the upper limb, paralysis of the lower limb, paralysis of the one half, or maybe somebody may be paralyzed and all the four limbs. This is usually identified with stroke. What do we mean by stroke itself? Stroke, as the English terminology tells me something that is suddenly happening. Strike. Somebody develops a sudden weakness. Is commonly identified as paralytic stroke.
Hmm.
What happens here is suddenly a part of the brain controlling the movement of the one part of the body becomes dysfunctional. Why?
Hmm.
Can you recollect what is that it brain requires every minute, every second? A good circulation,
Hmm.
a blood rich with oxygen and glucose is absolutely essential every minute for the normal functioning of the brain. Moment it is cut off, it is like any other electrical apparatus where you cut off the power, switch off, it goes switch off. And then it can lead to a permanent damage depending upon the duration for which it is cut off. So a blood supply cut off to a particular part of the brain is stroke, something like an heart attack. People
Hmm.
also call it today brain attack, because that attack word signifies its importance, how alert one has to be.
Hmm.
Only thing is, it is not, we identify very easily if somebody has got a weakness of the limbs as paralysis or if he becomes unconscious. But as I think we discussed a couple of days back, the brain is huge, sitting inside the skull. Actually, the portion that moves our body is very little. It has got a lot of other functions.
Hmm.
Somebody may suddenly lose vision in one eye. Somebody can lose hearing in an eye. Somebody can lose smell. Whichever part of the brain which is controlling, as I told you, different parts of the brain can controls different aspects of our conscious movement or actions. If it is sensory organs like the eyes, ears, tongue, nose, etc., we lose that function.
Hmm.
And sometimes, if it is a smaller area, if it is affected, we miss it. Some areas, like sometimes we are all thinking, we are talking. Somebody may lose speech. Somebody may be able to talk but may not be able to understand. A comprehension deficit.
So
All
actually,
these can be a type of stroke.
so this actually is very interesting because about 15 years plus ago, I had gone to visit my uncle
Mhm.
and I left my mom there and I went out with my cousins to dine. and my mom calls me saying that, your uncle was speaking to all of us normally, and suddenly he asked me, "Who are you?"
Mm-hmm.
Right? And she said that he's having an unusual behavioral pattern. So I said, "Look, I think this needs immediate attention." I drove back and picked him up. When I saw him, I felt that he was having a stroke. And so I rushed him to the hospital, and then obviously they started the care. So it turned out that what we did was the right thing, because somebody else was thinking, no, 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 this is just that he's, normal. Sometimes he gets all of this headache, and he's just, trying to, we'll give him some rest, and maybe he'll be okay and stuff like that. But something told me and my mom and my aunt that no, this is not usual. And we immediately rushed him to an hospital, which was the right thing to do, because as we landed in the hospital, they did his scans and said that he's going through a stroke. And
Mm-hmm.
at the end of it, he actually had a damage which was so unusual to us, which was that he could just not name things. So he would say that this thing,
That thing.
yeah, this thing with which you talk to people, but he can't say it's a mobile phone. He would say that what you're wearing, he can't say it's a tie. So he lost that.
Naming ability.
Correct.
That's what I think. When I'm speaking, there are so many components involved. We go back to basic functioning.
Right.
First, I have to learn a language.
Mm.
Then my mind analyzes, if I know the language, what you're speaking,
Mm.
and then it has to respond. It prepares a response, and it has to come out in verbal form sometimes it has to be in writing form. All these are different components of a speech, and different areas of brain which are connected in turn we call a Pape circuit. It starts from somewhere. If I can point, here is where is what we say that on the left side, we call sometimes Broca's area, the person who identified that area where the speech what is coming out, but it is processed behind. And here is comprehension at this point where it is understood, and they are connected. Sometimes there may be breaking, he wants to say, then there are certain areas here higher above which can remember the name, many a times. So what is important is, I'm not going to teach you a whole lot of neurology. What is important, what you did, there is something acutely going wrong.
Yeah.
Generally it is considered as somebody suddenly can be confused about time, place and person, disoriented. That's called acute confusional status. It can happen with again uh, low oxygen content and extreme agitated status, and it can vary.
Could it also happen because of fluctuations in electrolytes?
Yeah, it can definitely. As we other day discussed, that it's not just oxygen and glucose.
Hmm.
It's the electrolytes, especially the sodium and the potassium and the calcium. Sodium, and especially elderly. Tell me, your uncle was, how old was he?
He was about 60 to 65, maybe.
Diabetic,
And yes, he was diabetic. Yes.
hypertensive?
Hypertensive. Yes.
Oh,
Yes.
yeah. He has got all the,
Thank you, Sanjay.
thank you,
Right.
premorbid conditions
Right.
which makes you prone for a stroke.
Hmm.
Only thing is, he must have had stroke in an area which is concerned with naming. Some other
Correct.
areas of the brain is there, we saw medial temporal, where patient forget the faces,
Oh God.
and sometimes they that give a wrong name comes out. For instance, this is nice, thank you very much, nice biscuit to eat. I may call this as tea and this as something else.
Oh, really?
Yes. So these are definitive brain functions disturbance, and when it happens acutely, we must rush. Why do we rush? Because the damage, if it is temporary, it is reversible within certain period. We call a golden hour. When the blood supply is cut off to the brain, partially or fully, today, if it is As the time passes, the damage happens is irreversible, and also the area for which is covered by the particular blood vessels. You know, it's like a blood vessels are after, like, you have a main tap coming to your house, and if you the lowest point should will always be getting blood, right? Now suppose there the blood starts, I mean the water starts coming down in pressure, then you should quickly go and correct it, because other areas may soon get blocked.
Hmm.
So that is why the concept of that identifying early these symptoms and rushing him to a hospital of what today, hospital of the nature where it can be reversed. It is not just possible if you diagnose.
Hmm.
You should be able to have personnel who can diagnose. Then you should be able to, minimal investigation will require a CT scanning to look for stroke. The specialized type of scanning has to be done, and immediately measures have to be taken. Like either we have a block in the blood vessel which is reducing the clot, a clot in the blood vessel, or what we call a thrombus, which is reducing the blood flow, or it may be a burst of the vessel. Two have a totally different way we have to approach to treat.
Hmm.
That's why the concept of golden hour has
No.
come.
So, Chief, like going back to where my uncle was, and everybody in the family actually thought he was playing a prank.
Mhm.
That he's just saying, "Who am
Naturally.
I? Where am I? Who are you?" to his wife, "Who are you?" to his sister, and "What's your name?" kind of a thing. But no sooner than later we recognized that there was something really wrong, and we rushed him. But now, let's say I was there with some knowledge of what was happening, and like you said, the golden hour is important. I was able to make calls, get things prepared with my friends who probably saw him and stuff like that. Now, if there is somebody who is at home, how does, or office, or somebody is traveling, uh, what are the things that a person must watch out for and identify that this is a stroke? Second, what is the immediate actionable item that the person who is next to this person who is going through the stroke should do, so that maybe he can lessen the intensity? Is there something that is possible to be done? And third, how can one prevent an event of stroke from happening?
See, as I told you, stroke uh, means suddenly there is some disturbance, mostly in the quantity of blood that goes to a particular area of the brain. It can be to a larger area, it can be to a smaller area.
Hmm.
So, also we know that different parts of the brain control different functions. So, any dysfunction of each one of these organs which are under our voluntary control, we can easily recognize. For instance, one of the common thing in the elderly, what we say atherosclerotic disease suffering, with a blood pressure, there is a variation in the blood pressure when we stand up, when we are sitting and lying down. There will be a tendency with the age, and those who are on certain antihypertensives, what we call for against the blood pressure, and people with diabetes, what we call autonomic disturbances, means automatically, naturally,
Hmm.
it controls. Moment we stand up, it has to pump at a higher pressure. Otherwise, by gravity, we require a different pressure falls. All
Hmm.
these are autonomically taken care of, but autonomic dysfunctions can happen very commonly with the age and very commonly with the in diabetics. So in such people, what happens suddenly when they sit and get up, they start feeling giddy.
Hmm.
And moment they sit down, it may improve. Here is a situation, there is a transiently reduced blood flow to the brain.
Hmm.
We sometimes call maybe a warning transient ischemic attack. Ischemic means a blood cell bleaching of the brain. It's
Hmm.
something like a voltage drop, but it comes back. But if it is frequently happening, even if it is you're a diabetic, well known, even if you are hypertensive, certain medications can make, or you suddenly get up from the sleep, it can happen. One should get an evaluation about the blood vessels, because nothing prevents you from additionally having a blood block also.
Hmm.
This is one of the common symptoms which are missed.
Hmm.
Then a series of evaluation, including your brain scan and the blood vessels to the brain. There are 4 blood vessels which go through your neck into the brain. We call the carotids and the vertebral arteries. They had to be scanned to know what is happening. That is one symptom. That is attacks of vertigo varying with posture, especially sitting and standing or lying down and getting up.
Hmm.
Next, very common thing is, let's go from each organ we have. Eye is very important, right? Topmost. When we say vertigo or suddenly uh, developing the whole brain dysfunction or certain portion of the hind brain dysfunction is what we are talking about. Eyes.
Hmm.
If the blood supply to one eye now gets blocked, this very micro clot, we use a term called visual obscuration. Suddenly one eye suddenly amaurosis fugax, we say in medical terminology. Means suddenly it blacks out one eye transiently and recovers. That means a small clot might have gone and blocked it and thrown out. That is another symptom. If it is happening, you must go. So early warning signs
Hmm.
without allowing it to go for complete stroke. Then similarly, if we have one portion of the face or hand or limb becoming numb,
Hmm.
you're not feeling it or feeling abnormally like a cold sensation or anything, like a wave. Sometimes it comes like a wave and goes, as because in early phases what happens is like a voltage drop, before something disconnects or burns off. That are the symptoms. Again, one has to think possibility of stroke. Of course, there are many other causes, but from there, definitely it is neurology related. So one has to evaluate. We start evaluating for a stroke. Now, earlier we go, we do not know. Sometimes there may be a gap of few days to few weeks. Sometimes it may be within few hours. It may progress to a major event, to a permanent weakness.
Hmm.
Then we have, of course, weakness. Suddenly you felt grip something falling off. Suddenly you stood up on one side, your tendency to fall off. You're losing balance while walking. These are very common symptoms. Apart from the one major what you said, the conscious level itself, fluctuation in the conscious level, or speech,
Hmm.
or not able to understand what is being spoken to,
Slurring of speech.
slurring of speech, or missing the direction of walking out. For instance, we are sitting here and suddenly it's your clinic and you know which door to how you walk out. But this person may miss because the certain areas of the brain which directional sense is lost, or you may be having lost vision on one half, so you may go and knock yourself against the door.
Hmm.
These are all individual symptoms, but very unfortunately is if it happens in the sleep,
Hmm.
very difficult. Most often we see them as falls, you know.
Hmm.
And other thing is sometimes we call a thrombotic stroke, where patient starts getting headache
Hmm.
first and then followed by sudden loss of consciousness or paralysis. So in all these events, one has to reach a neurological consultation
So,
and an
if I
emergency.
understand you right, uh, it is important to identify some of these symptoms and reach to a caregiving facility which at minimum has some of these advanced methods to evaluate. So it's not about reaching out to a doctor or to a nearby
Yes,
facility which doesn't have a scanning.
absolutely.
it's actually wasting of time.
because
Am I
there are
right in
other
saying this?
causes. And again, I think I mentioned it earlier to you. There are two kinds of strokes. One with a bleed, a whole blood vessel bursts.
Hmm.
They're totally different thing. Other thing is where the blood vessel is kind of getting clotted, just like the heart attack happens. Blood vessel is getting blocked. If it frequently happen, sometimes if you are not already on a simple drug like aspirin,
Hmm.
and if you are already having disturbances in the cholesterol or lipid metabolism, if you are already on statins or something, better to take one more dose, because if there are some acute clots, they can be broken.
So,
Or prevent further clot formation till you reach a facility where today we have medicines and technology where we can retrieve the clot from the brain blood vessels. We can break the clot
so
and
what's a
establish
person,
circulation.
what is a family member or a person in a work environment do
Mhm.
if he identifies that somebody is going through stroke? So one you're saying is start off with statins if they are on, take an additional dose
Yes, and an aspirin.
and an aspirin, a blood thinner. But is there something, so uh, I don't think it's a recommendation that every householder has,
Yeah.
maybe people are not on aspirins and statins. So should we stock them at home?
No, definitely you can't, because it can be double-edged weapon at some times. In the known
Mm.
patient is different, because I told you if it is hemorrhage, this is going to worsen the hemorrhage, means
Mm.
bleeding.
So,
Yes.
so what can be done at home with what's available at
A
home
simple,
or office?
yeah, very simple thing is uh, best is as far as possible to put the person flat. By that, by gravity, the blood supply going less to the brain is reduced, or at least keep an angle of 20 degrees head elevated and raise the leg. Suppose it is just a simple drop in blood pressure. Raise the, we call it syncopal attack,
Mm.
People get up, stand up, and they'll feel giddy. The blood pressure drops. So put them immediately flat, raise the legs, the blood pressure comes up. You're not ready with a blood pressure apparatus and all that, unless you're already known, you're prone and elderly, has had some ailments like chest pain or being treated for blood pressure. I don't think on a routine everybody has a blood pressure apparatus or something in the hospital.
Mm.
These are the minimal thing to be done, and check the level of the sensorium, and if their mouth or anything is dry, if they're conscious enough, give them liquids, because a concentrated blood is more prone for clotting than adequate oxygen. Means you don't have an oxygen cylinder, it is all right, but at least if they're wearing something that tie like me, free everything, make them breathe, preferably put them on one side, just in case they develop a seizure or going to become a bigger stroke and unconscious. Then breathing on the side is easier, because sudden vomit etc they can aspirate, and then reach out for medical help. And I would suggest that all major uh, workplaces should have a list of hospital with these facilities. Every home, every apartment, they should have a list of hospitals nearest, reachable, and also responsible to respond to your calls on such event, whether it is a heart attack or a brain attack, because both time is essence,
Mm.
very much in essence. Sometimes we will feel very bad, and nowadays with the diabetes, hypertension, anxiety related disorders, and COVID has caused a lot of younger people developing stroke. Apart from our great stimulants
Hmm.
like nicotine, cigarette, and alcohol, etc. And one has to be ready with this.
So actually, very well said. I was at one point 15 years ago, or maybe 20 years ago, staying in an apartment, and I was surprised to see in an emergency situation, the person who had this was in maybe 15th floor or something like that, and they didn't even have a stretcher to actually bring him down, because the person was not in a state. How are you going to carry that person, right? So I think it's a very valid tip for every apartment households and stuff like that, to ensure that there's smooth transition with some basic things to come by. But there's also one
If you
thing.
say about lift, I tell you, there are many apartments being built in Bangalore where stretcher can't go.
Correct.
Second tip to the
So that was
people,
exactly the problem. So even though,
even if you have a stretcher or you're
yeah,
going to make a makeshift stretcher, they don't have enough place. Second thing is, uh, fortunately, many big apartment complexes are managed by their own management committee of the
residents
members,
association.
residents association. My suggestion to them is, make certain if there is a problem with the lift, the service lift always works first, because that is an emergency lift, like for the patient and all that.
Yeah.
If it is not emergency, it doesn't matter if I walk down or walk up, but a patient thing. Then nowadays I see many of them having wheelchair. Fortunately, there are wheelchairs today available with just 14,000-15,000 rupees worth, which can be converted into a stretcher. They're called stretcher wheelchairs.
Right.
To various angle you can stretch, and very easy to move than the complete stretcher. If you have a stretcher, well and good, but this is very easy to store. You can otherwise use them as stretcher wheelchair. I found, fortunately, Amazon sells it across various brands. It's a wonderful thing.
I've also noticed something else. It's like, laymen who are in residential places, not maybe uh, having the foresight to build emergency compatible structures or lifts and so on and so forth. But the unfortunate reality is that how many hospitals truly are having dedicated scanning machines when a patient comes under emergency? Because I myself have faced this, that I took a suspected person with stroke, and right in that hospital, under the bed, it was written that in the next 20 minutes a scanning must be done if it's suspected of stroke. But there was only one scanning machine which was used for emergency, which was being used for inpatients, which is also being used for patients on routine scans and diagnosis. And so the wait time for a scan was almost 2 hours. And here we are talking about diagnosis and treatment starting within the golden hour. In Bangalore, I don't know how many people can reach a hospital in 15 minutes after an event has happened. Let's say the least would be a 30-minute, and then the unfortunate processes within the healthcare system, and then a wait. So I personally waited with a patient suspected to have had a stroke for a scan for 2 hours in a leading facility in Bangalore. Why are we as healthcare professionals not making sure that patients who come to our hospitals on emergency be seen truly on emergency?
Yeah, you opened a Pandora box, I'll tell you. There was a situation close to when I started my practice in 87 at St. John's Medical College. This city of Bangalore had only 2 CT scanners that had newly come. We used to put the patient, because I used to insist upon, because I was trained, I knew the benefits of a scan versus doing simply an X-ray or waiting for the next day. I used to pack the patient in an ambulance, send all the way across. Those days, at least we could reach in half an hour from St. John's to Cunningham Road or Infantry Road. But today, imagine if you had to do that. From that status, you have got the present hospital where I am working. We have within 100 meters 5 CT and MRI scanning centers. Now, from that day till today, I went on insisting upon every institution I have been working with. My first criteria, you must have your own CT scanner and MRI if possible, at least a CT scan, otherwise I am not going to enter. Reason being, I don't know, today we may be, those days were only two, it may be more than 100 or 200 in the city. But diagnostic centers are not meant, according to me, for emergencies.
Perfect.
What happens is, I go to a nearest hospital, everybody puts up emergency care. But what emergency care we have to put it up? What is feasible to be seen there?
Hmm.
Then somebody there examines you. We do not know, most often than not, most posh looking nursing homes are nursing homes. They're good. We need in the society nursing homes to take care of different kind of people, not this kind of an emergency. Oh, somebody has cut something. Okay, yeah. But do you have the facility to resuscitate a patient?
Hmm.
If somebody is choked and something has gone into the throat of a child, is that person sitting in the emergency capable of doing these procedures? You can't wait. I'm a neurosurgeon. Will I be there in the hospital? My expertise, no. But emergency person knows to resuscitate, knows to pick up a stroke, get the investigation done even before a neurologist or a neurosurgeon comes. Be stroke, be it be head injury or any cause of unconsciousness, he should be able to attend, evaluate and diagnose immediately. Because I told you, more and more we are investigating, more and more different causes for the same event. Just a little deviation and take you. Paralysis means a dysfunction. It's telling no light in this room. That's all. It may be a voltage fluctuation. It may be a problem in the loose contact with the bulb there. It may be something wrong with the holder. It may be something wrong with the wire, something wrong with the switch, something wrong with the fuse box, the main connection, or your generation power itself may be down. That's how it is, the different causes. But what one sees here, if I just touch, it may become all right. So lay public, and also sometimes I think people get hoodwinked very easily. They said he was paralyzed, oh, he became all right, somebody touched or massaged. It may be some loose contact situation where you just touch the bulb, it become all right. So they think that is the norm. So there is no standardization of these protocols. Emergency, what emergency can we see? You have to categorize level 1, level 2, what kind? Heart attack patient, will he be revived?
Actually, that's a
Brain
wonderful.
attack patient. So hospitals have to announce. That is why globally it has come a stroke awareness program. I think in the coming week we are having a World Stroke Day. Each year the awareness is becoming more. So I would say rush, don't wait for a particular doctor or a particular place, reach to a nearest place, but it should have this. If it is heart, at least it gives you few hours. If it is something related with the brain, stroke or epilepsy, as far as possible, you must try and reach a hospital which has got a in-house CT scanning, in-house neurologists and in-house emergency services. Means not just the beds, the personnel who is capable of fully resuscitating, putting him on ventilator if required.
But how would a layman understand this?
See, this is
It's very difficult
this is
because
the talk.
Yeah.
And this is the message that has to go. And the hospital which have these facilities have to put it up. And I would request even the media, make a list of it. And I keep seeing in many newspapers bringing out the best hospital, best hospital. What does it mean? It is meaningless.
and all kinds of
Is it
awards
really with
everybody is
honesty it is being done? On the contrary, they should bring out every 6 months. The government should do it, the private should do it, whoever is concerned, they should think of themselves. It may be your own kith and kin who is going to be affected. I might have billions of rupees with me, but if I am not aware of, by the time I realize somebody tells contact 10 people, then they go to wait for their many times. They wait for their physician till evening because he's not available. Morning I felt giddy. So by the time they wait, then he will see, he will recommend scan. Then you go to a scanning center. Then you wait, come back after the scanning center, but the report has to be available.
I
All
feel
kinds of delays happen in
feel
spite of facilities being available because wrong understanding. Diagnostic centers are good. Diagnostic centers are good for cold cases. And there was a time, as I told you, 30, 40 years ago, when we had very few diagnostic centers or capabilities to have the CT scan for the brain. Then we had no choice. But today we have choice, but we are misdirected.
Well, I think it's a very valid point. We are misdirected because of multiple reasons.
Yes.
Number one being that the levels of awareness among patients about what is optimal care that is required is missing. Two is there is lack of transparency among healthcare providers about what should be the minimum standard of care that should be provided to the patients, and transparency in how it should be provided and what is required. I go through this day in and day out because anybody who walks into our dental center feels that why is it so large? In one room, why is it not possible the size of the rooms that you have? I've been asked this question time and again in the last 24 years of this clinic that I have, that why is it so big? In this space you can put 4 chairs, and we have seen that happening time and again. But if you look at science, only post COVID people have started to recognize the importance of aerosol contamination. They have understood what infection control is. But we as doctors, like PPE was not new to us, right? All my life I have only worked wearing a PPE kit. That is, isn't that the fundamental first chapter in our medical care, which is called barrier technique, right? But a common man now knows what is a mask, what is a head cap, what is a PPE kit, and so on and so forth. So, have we ourselves created this ignorance among people, not because we are not able to for some reason practice things in the right way? When people come and ask me this question, is this required, like why do you have such a big facility? The least that I can transmit as a dentist to a patient is hepatitis, tuberculosis, and all kinds of viruses and HIV. Because every simple procedure like a cleaning of a tooth has blood contact, right? So we have compromised on what is optimal care required for a person. And then that has become the norm, unfortunately. To me, as a doctor, it is you must never compromise on certain things that is going to take away the life and health of a person, because if that doesn't exist, like you said, you can be a billionaire. What is the use of all that money if you don't have health? How can you function?
And lose health
Lose health,
because of lack of knowledge or awareness.
right? So like when I also walk into hospital systems, I wonder how we have created these dingy hospitals. What is this? To me, to my mind, frankly, I feel, why have we even created this multi-level
That we
beds?
started off as, like a poor country, nothing is better.
Yeah.
Something is better than nothing. But what I am trying to tell you, that was few years back. Now you have facilities available, but you are also aware of. I am not telling that people are not aware of, but what is missing is the information. Yes, like suppose I am in a remote village, where whatever I do, if I am not able to move to a hospital center, what we call it as a stroke ready hospital. For instance, we have branded uh, our hospital as a stroke ready hospital after we got everything. Till that time we did not use the word, means completely. Some of them are required for cold cases also, but for instance we need an angiographic setup, that which we got it a few years back. Now we are 100% stroke ready,
Right.
personnel and the infrastructure. And if a person reaches you on time, we are able to carry out everything that is possible for needed for the particular kind of a stroke. So that is what one has to make a list. Suppose we really do not have, then fine, okay, at least give some oxygen, try and protect the remaining brain, maintain blood pressure. That most of the hospitals will be able to do. Same thing happens, I'll tell you, because I'm a neurosurgeon. Apart from stroke, another emergency, because commonly head injuries. Now it's happening. Yeah, if the patient is unconscious, we take to the hospital. They don't have a CT scan. They don't know what is the cause. Is a clot or not clot? Then you send me across in Bangalore traffic. Some 2 hours to another diagnostic center. Diagnosis comes back. Then you call a neurosurgeon. You have lost very valuable time and human being.
Let me ask you a very important question, which I'm sure the viewers would be interested to know. We've been talking about CT scan, MRI, or a scan that needs to be done. Fundamentally, what is a CT scan and what is the difference between an MRI and a CT scan? The fundamental difference. Second, which scan is done for what condition? And the last question is, why is it that at least the MRI scan is so traumatic for somebody to go through?
Srivats, I will take that question after completing the answer to the previous question, because this is something I have been fighting and I've been partly successful in wherever I've been working to induce that when you say that you're capable of doing certain level of work, we should provide fully. Now, just going back to it, who are all responsible? Is it only the hospital? Is it the public? Is it the government? I think everybody is responsible in their own way. Because one thing in all the countries, whether you take in developed countries, what are they ultimately scared of? Once the protocol is made and approved by FDA, you have to follow. Otherwise, you're legally liable. Because ultimately, in spite of all the science, all the good nature of human being to help others, you need a policeman. So we need bodies that has been well established. We have got Stroke Society of India. For instance, if you're taking stroke, apart from Neurological Society, Neurosurgical Society, Neurology Academy, Epilepsy Academy, all that. So each body has looked into the available scientific data and brought out the protocols, what medicines to use, what time to use, how to be treated, what is the investigation required. They are very much standardized. Now, they have done that part of the thing. They have going from knocking doors from pillar to post, from government to non-governmental agency. Then individual doctor. If somebody calls me as a neurosurgeon or a neurologist in a hospital, then I should tell this is the level of work I can do with this much infrastructure. Deny them, convince them. They may not be aware of. As you rightly said, no? Oh, there are people who are, most people think that filling the teeth and pulling out the tooth are the only two things in the dentistry. Why somebody requires such a huge place and multiple gadget, x-rays, that, this CT scan, what Dr. Srivats is asking. It is not to miss out. See, people quote statistics. Statistics is okay when you talk of big things, but what about an individual? If I will say I'm 90% certain, I don't know about your 10%, but if I have fallen that 10% and you let me die, which could have been treated, so that's how conscious we have to become. Yes, we have to try to reach. We may not be able to do 100%, but we start off telling us, okay, the statistics says that so many people can die still in spite of you and me. Now that is not the way. Next is the social societal structures. Organize. The very fact that me and you are spending our valuable time on this is not just why I wanted to have tea or biscuit with you. It's just let us spread the message, make awareness, do camps, prepare medias purely with the interest of healthcare of the individuals and the society. They should demand the hospital, go nearby hospital, ask or provide the hospital with facility. Simply throwing money, charity, various clubs are there. They don't know who will use it, what is the structure. And if you ask me, you can even make a good hospital, it may be private hospital, go and give them if they have short of this money, provided, and you do at this concession because I have given you this equipment. Are we doing that? We don't. Moment we think of charity, you go and give it a place where nothing is there. Because healthcare today is tired. So we have to look at where we are providing the facility, what is the outcome of it. Or do we have the personnel? Like somebody will suddenly sanction some equipment all over the district hospital without personnel. So within 6 months, warranty time expires. We have been seeing it, right? So this another societal responsibility. Somebody should be auditing this. The newspapers, magazines, they should all dedicate. List out like this. What do I mean by top 100 hospitals? I get very, very irritated, Srivats, when I see this. Who has assessed? On what grounds has been assessed? Is it business front of it?
Best doctor of Bangalore.
Who has assessed all that? Who are you to assess?
Well, I also have
It is required. Recognition is always required. Recognition is the method of encouraging good things happening, encourages people to attain certain levels of competency. Service should be recognized. Then the message has to be spread. People will become aware of it. That is necessity. But what method are you using? No shortcut method for all this. So each one of us is responsible. That's what I told the story of billionaires. It has happened. I do not want to give names. Yesterday, I think I told you that some person one of his own family member is being treated for the same purpose. He goes to somebody else of different specialty. I'm not worried about some other neurosurgeon. He's not even bothered. So I am X person's dog. Doctor. Somebody else is some Y person's doctor. So you have your own imagination. The wrongly informed. It's not informed, wrongly informed. So all these things have to be corrected. I think this is a good step we are taking. One of the small steps.
Also, you brought out a very important aspect of charity, which is so true.
I have still not answered your previous question.
Yes, we'll come to that. So you said two things. One is no compromise in healthcare, and I love that because I think if we do a compromised care provision in healthcare, it's the biggest crime that we're actually delivering. So every doctor, every healthcare facility, and a practitioner or persons who want to set up healthcare facilities must be absolutely conscious and cognizant of this fact that what am I compromising for? And it is the worst thing to do to keep a patient or a community ignorant of all of these things and go ahead and do it. It's the highest level of lack of integrity, I would think. Number one. Number two, I liked what you said about the quality of care should never be compromised because somebody may fall in that 10%. And charity, what you said, because in charity somebody is paying. Actually, there's no free care or subsidized care. Somebody is paying for it, right? I run a charity of our own thing, as you're aware of, and a lot of people approach us, like many social organizations, many people who want to do it, and people do charity for various reasons. Most people come for banners to be put, right, and photos to be clicked saying we did this, we did that.
In the temple, they have asked, no, God is there because I have donated. Otherwise, He is not there.
Right? So, one of the stark realities that they face when they approach me is I would say I would not do a compromised care even in charity because I cannot compromise on my infection control
Yeah.
when I'm doing it, because there's a gullible person who, just because he doesn't have money, right?
You hit the nail on the head.
Am I going to give him HIV? How can I sleep, right, without infection control? Like, I see, okay, you don't want to do it, we'll align with somebody else or some dental school which wants to come and do it for us. But look at what we're doing. The same forceps, we're just going on extracting multiple people's teeth. Is that even acceptable? Right? And
Or
so
do we have to go to the disposable ones in the West? See, that comes back to the point, a simple thing for we are on the crossroads, especially here. Because of the large population and very poor infrastructure what we had few years ago, we still have, if you say total distribution, we may be still lacking. But what I am trying to bring about that is those where we say we have evolved, where we say we are doing. Let's not talk much about the affordable medical care. Okay, it's another big topic.
yeah.
But what I'm telling you, when I say I'm a premier person, are you providing what is the thing to be provided as per accepted norm of the day? That is where no compromise. Second thing, where the compromise is there, I tell you, there is a networking that should be possible, which I think you tried yourself doing. Like, if I have an X disease, I cannot say if you have this much money only, this much, it's okay. Rice, at least I can say, okay, eat less. For I cannot give you for 2 rupees 10 kilos. I'll give you only 1 kilo rice, right? Or it has to be free, provided that 1 kilo is the minimum that person needs. In healthcare, we cannot say, I will give you only half the tablets because I'll give you a cheaper tablet because you don't have money, or if you have money, I'll give you the very highest, most strong antibiotic.
Or I'll treat only 2 conditions of the 3 that you have.
Correct. So, what is happening here is, firstly, you have rightly said, the medical professional had to be very strong. Yes, I am compromised. What do? Then you network yourself. I'll tell you, for instance, that's where categorization of the hospitals are required. See, like I tell you, small example. Few years ago, there used to be always fight. When I started neurosurgery at St. John's, we were the only other institute outside NIMHANS which is treating any kind of neurosurgical problems, including head injuries. People generally think neurosurgeon those days used to think means only head injury. They never knew that other diseases which we are going to talk about, that the neurosurgeon treats. For instance, I don't treat a head injury at all because my colleagues treat. So what is to happen? Every patient with a scratch on the head would land up in a facility which had all the requirement for neurosurgery. It is not necessary. Nobody else would touch. That is one way of wasting your infrastructure facility. So same demands. Several times they tried, the previous directors, we used to have several discussions to categorize it and split into several things. Then the Sanjay Gandhi Hospital, trauma hospital came. But somehow a lot of what I should say, anything to do with government has got a lot of other controls, whether to post a neurosurgeon there, whether to have a neurosurgical center there. In the night, patients would move from Sanjay Gandhi Hospital. After reaching there at the trauma center, somebody would have taken, and they'll come here and go back. This all kind of a things. Today, hospitals have to network. I may not be able to have everything. I should have, if the X hospital has got, it should have 1, 2, 3 tiers. Or if it is not your own, you tie up with the other hospitals. This is not happening. Right. Same thing should happen with the specialists. We have to realize that our aim is to provide the best possible treatment for a given situation to a given patient. I may not be fully equipped, or I may not be fully skilled to do that or trained to do that, but I should have a network of people who can respond to that. That is missing. There are other considerations that are coming into. Ideally, there should be a team of doctors in major specialties like neurosurgery. For instance, dentists today is not just pulling out the teeth. There are so many things. Preserving your teeth is the most important thing.
Right.
Preventing its damage, and it requires, you are the expert. You know how many things that require. That's why we set up this huge clinic with multiple specialists here. It costs you. Right. And you will be always thinking how I can bring down the cost. Okay, I'm just giving an example. Srivats, you have a diagnostic clinic. Okay, you keep a minimal money, and then you said, okay, you don't require anything. You just require cleaning. You go to this clinic where the infrastructure may not be complete. It may be not yours. If you are a chain of hospital, you should do like that. Not duplicate everywhere the same setup. What I am annoyed is the big chain of hospitals also do not link up hospitals. They can afford today to have their own different levels of hospitals.
But the thought process, unfortunately, for everything, including medicine, it's become capitalism. It's about business. It's about your top line and your bottom line, right? So unless we change that mindset, look at even people who are investing into healthcare, right? So I think there either has to be regulations that must be there, that only these sort of investors must be allowed to invest into healthcare. Otherwise, let's say a doctorpreneur, a doctor who wants to be an entrepreneur, knows all of these fundamentals but is never given that possibility for growth, because at the end of it, you forget what you're doing as a doctor and then you start shortchanging things for the benefit of profits. And that is something where compromise of care begins. That's the first step. And so, how many places I honestly would like to encourage investors also to invest into healthcare. Everybody's focus today is healthcare because they think that seniors are going to be in higher numbers, care is going to be increasing. Let's do more senior living, let's do these diseases because these diseases are going to increase in the future. And so investments come in for those reasons of profitability. But actually, if we turn our focus out of simply profitability and look at providing good care or uncompromised care, why do you think with such a large amount of population it is still not going to be profitable? The problem is we draw a graph and say we begin here in 2024 and by 2028 we have to be here. And when we set these rules, we forget what should it be that we should go from here to here, and how do we get there is never a question. You do whatever you want, but we will get there. So then we shortchange things versus let's do these 10 things uncompromised. So even by 2027, if this is where you have to be, even if you reach here, it's still okay. But have you done the right things to your patients?
Srivats,
This attitude, if it comes, that is the only savior, because I don't know of many doctors who have the money to actually go ahead and do things which are right for their patients as individuals, because doctors as individuals don't have the bandwidth, knowledge, inclination, plus the finances to actually go ahead and build hospitals like the ones that are being built. But if they're cognizant and conscious of the investing money that's coming in, and if we all build this insight into investors, probably they also don't know. But if we are able to do or bring in conscious investments because it's a healthcare thing, right? Then I feel this entire mistrust today, what are we facing as doctors? Mistrust or distrust with our patients. That's why they want five opinions. That's why they want Google. That's why they want AI now, right? I see the road ahead is going to be even difficult for a good doctor or a bad doctor or any doctor to consult. To be very honest, I must make this statement that I'm yet to come across a doctor who wants to kill his patient, a doctor who wants to harm a patient, right? There can be lack of knowledge, there can be lack of access, and obviously there is that gray area surrounding our field, which is that something can happen which even we don't have answers for in terms of a failure in a procedure or some care that we are providing. So most doctors have very good intent, but unfortunately we are stuck in this entire whirlpool. And unless this is released, I don't see a way wherein we can actually improve health of people.
Srivats, as I told you, it is a Pandora box. If you have to think, I would rather, you know, um, split it into several compartments and try to see how it can bring back. For instance, few centuries ago, there were no concept of huge hospitals. There was individual doctors and the clinic. So from the primarily doctor-oriented healthcare system globally, it moved to a larger and larger thing, specialization, then the infrastructure requirement called the hospital and the equipment, then the drugs, the pharma, right? Now, from a totally a private propriety, it has become a public need.
Hmm.
You know, today everybody openly accepts. It's not the problem only with India. Globally, economics, and if you're linking economics and healthcare, it is a total failure. People have tried pure governmental, like even the NHS. I am told that not everybody is happy.
Nobody's happy, yeah.
And then pure private, insurance based, not happy again, because somebody has to pay. You rightly said somebody has to earn and pay.
Yeah,
Nothing is coming free. It is not grown on the trees. Even the trees have to be grown, like it is
absolutely.
not grown on the trees. Equipment, medicines, facilities, employee, it's not required. So one end, scientifically we are progressing. We are protocolized medicines we are bringing. What are the good? Let us talk segment wise. What are the goods about protocolized medicine? So that the common things are not missed, And if large number of people apply the same principles of either in diagnosis, clinical diagnosis, investigation protocol, laboratory protocols, and the treatment protocol, the average outcome will be of some standard, right? We know that in individual cases, all tests may not be required. You may be able to arrive at the third point only, but we have to, as I told you already, statistics do not apply here. So, to spread the message across, protocols are formed, which makes it little expensive. Like what you said, you have a clinic. Not every procedure you require somebody, you may be just examining. You may need not even touch him, maybe just taking history. Will he require all this special laminar flow air conditioning, UV light, all the sterilized thing, disposable gloves, disposable mask? May not. But if he goes one step ahead, you have to. But do you expect on the same day all patients who are requiring a procedure to be done which requires all these facilities? So you will have to create a structure, infrastructure which can care for both. That means for you have to distribute the cost of infrastructure. That is one problem in a protocolized medicine. On the contrary, definitely it is able to deliver. Then we should look within that how to economize. I said one of the things like that leveling, grading, and protocolize for steps wise once we know fairly doing. I think probably here AI to bring out algorithms in many treatments. Today stroke protocol is AI driven. You can see it across the world, and where radiological images are being protocolized through AI and tell this is the one which will go for treatment, this is the one treatment, X treatment cannot be given, Y treatment, and people have found very good results. That is one way of bringing down. Second thing, in medicine, in the hospitals, when we consider a lot of personnel, they are required apart from the doctors. And the same doctors get tired because human beings to do. So many times we are doing clerical job. So we employed other clerics who are also human beings. We are paramedics, etc. Whether we can reduce that, you may use robots. If it is repetitive work, untiringly it will keep doing. It will reduce the cost. So that is one way of looking. Second thing, which government on earth is spending same amount of money as defense? We are all spending from anywhere 15%, 20% to 30%. I don't know how much Israel spends on the defense, and who is paying? People are paid for it. But your defense against an enemy from outside, what about defense against the enemy inside who is going to cause me diseases? Or if I got a disease to take care of me and rehab me? Nobody is bothered about, nobody is questioning the governments. And third thing, we know globally there is nothing wrong whether it comes to education today or healthcare or food, private participation is a must. Whenever private participation, there are three types of private participation. I said individual, charitable institution, somebody has earned somewhere else and put the money here. He also did not grow on the tree. At least he has got the good sense that part of my profits I am going to give it for charity. Now, charitable institutions, most of them have become like the government institution where nobody is responsible. Law doesn't protect them but does not protect a private person. A differential law for medico legal implications. How is it that a doctor is a doctor, infrastructure is infrastructure? Why you can't sue? Like a lot of people say, if I have an accident on the road due to a pothole, unfortunately some other vehicle comes nearby, that fellow is blamed on insurance. Which insurance is against the government? Only some mass casualty happens, government will distribute some dolls giving few lakhs rupees or few thousand rupees telling that human worth is that much. Whereas he is a rightful citizen, more than any one of the politicians or the one who are governing this country. We don't ask their question. So now we allowed the private people. Now private people, when you allowed, you called it an industry. Srivats, don't believe it or not, I don't want to name one of the persons pioneer in starting private hospitalization. I asked as a young neurosurgeon 30 years back, sir, why do you call hospital as an industry? For me, it was like a shock,
Healthcare industry.
Healthcare industry. He said, young man, you do not know today, you just work. Now I realize the system has to be changed, the thinking process has to be changed, otherwise you have to work like an industry where, and then corporate houses who invest in that. You have been asking for investors. He wants a profitability. Okay. Is there a ceiling? So who is the target? Very easily they will target the doctor because you are the final deliverer. Yes, it is like putting all the moral constraints, ethical constraints. I am not telling it should be away, but you have been tied up everywhere. It is not your own hospital. You are supposed to make profit for him. You have to make it cheaper for the patient. You have to give the best medicine for the patient. Otherwise,
Outcome should
if
be
you are not told that X hospital doesn't have this facility, hospital will kick you out. If you are not told and that fellow is wise, the court can kick you out. Why did you not warn the patient today? Vicarious responsibility is there, not today. Who is protecting all this? So it is becoming a blame game and cover up and front face. Front face of an hospital will be you ultimately because patient has come to you, not to the hospital. Who did all the thing? It went through your channel. Similarly, I tell you what happens in the wards, in the clinical wards. Who will be the person amongst the healthcare workers who will be always available? A nurse. Today in most corporate hospitals, they provide with secretaries, ward secretaries, everybody. What the poor patient recognizes somebody in uniform, a nurse. They will go and ask her all questions. If billing goes wrong, they will go and ask her. Medicine given late, they will go and ask her. Doctor did not come, they will go and ask her. Because she is the front office for the same thing happens to the doctor. Something goes wrong to the patient for whatever reason. There may be oxygen supply low that day. Who is answering you? Is there any monitoring? All these are put up on paper. And coming back, I'm not supporting the private hospitals fully, but they're also at loss. Government treats them as industry. Are they getting subsidy? Today, if I open some XY thing that weapons for the country, I'm given leased land, free land, tax-free land. Next 20 years, I'm not going to tax you. Have they done anything to any hospital? They are giving the electricity at the same as industrial rate. They are taxed at the same rate, power at the same rate, fuel at the, you are running a private clinic yourself. Are you getting any concession of all that? You are not getting. Why can't medical equipment be out of that bracket of 28% tax? Every time we have to beg and borrow the thing. They are essential for life. Very few. Now and then they will announce. This is for eye saving. Somebody, it's the emotional content. Somebody has raised an issue recently. Very good that you have to protect the papavirus cervical cancer vaccine. Oh, suddenly they will do. What about other disease? What do I care? What do I die of? So overall, why can't governments take a call on certain? They have made a list, but that is not at all comprehensive.
Actually, I completely endorse this that there has to be a change in the way healthcare
Is viewed.
delivery and healthcare quote unquote industry is. I've thought about this for several years. One of the probable models, I think, is a participation from government in setting up even private facilities. I think if there is a standard protocol that has to be driven with standard equipment line, because what is the biggest burner for a hospital or a clinic is the capital expenditure.
Yeah.
So I just always fancy this thought that all healthcare facilities capex should be taken up by a government, can be given to individual doctors or people to run those centers, and then there can be huge amount of reduction to the patient in terms of the expenses that they go through, and provide insurances
No, I
obviously.
feel more than that. See, every equipment is taxed, right? Today, medical equipment. Why can't you, if it is, you go through the bodies, as I told you, we got sufficient professional bodies. What are the essential items? I mean, it not have fancy items. Essential items you cut down, it will itself will, then you ask the hospital owner or the investor, you have to limit your profit. Then it is worth the while. Even then they will make profit because we have got huge numbers. See, people said do insurance. Now, where will insurance? Insurance is also a business. He has to make profit.
Exactly. But also, I'll tell you another gray area in medicine, which is that most healthcare facilities are trying to put their price points based on the kind of facility or equipment that they have. But for the patient's recovery, one of the most important things apart from technology or equipment line is the expertise of the doctor and the experience of the doctor. Look at what we have missed. In the top playing 11 of India's cricket team, there is a big difference between Virat Kohli's salary versus Rishabh Pant's salary per match, right? What is the difference? It's talent. But look at medicine, right? You are a neurosurgeon with 42 years or more than that in terms of experience, but you carry no differential value in your consultation or in your surgery against somebody who is 5 years into neurosurgery. And the patients also don't recognize this. Patients would come to you and say, okay, what does your global experience mean to me? Nothing. What does your degree mean to me? Nothing. What does your 27 years of practicing here and around the globe mean? Nothing, right? And I go ahead and do the same procedure, because even patients do equate how much are you charging versus somebody else charging. Whereas nobody would say, whereas you see in the Indian cricket team, when we were watching cricket, when Tendulkar used to play, if he gets out, we would feel now the entire team in the next 100 runs will get out. Or if there is a tough situation that we are facing, if Dhoni comes, there is hope that Dhoni came and he can hit one ball 6 runs. But isn't that so true as an analogy even in our practice of medicine? And why do people not
No,
recognize this?
I beg to differ with you. In general, the sports or an art like a cinema, they are not essential for life. You always pay a very high price. So you cannot compare that to essential service like healthcare. First of all, let us push it aside. I really do not know. For that matter, is gold as much useful as steel? Certainly a lot. We can live without gold, but nowhere comparable. You and me are sitting here in this house because of the steel and the mud, on some form of mud, but that is valued least compared to the gold or some other precious material. But in healthcare, there will be some difference. I would even encourage, if you are able to deliver the same amount of outcome with intensity, there should not be pay difference. What is happening at the level of, let us say, ultimately the doctors? This competitiveness invariably turns, as you said rightly, comparing yourself to some other profession. For instance, a fellow who gives an opinion about a structure of a building for 1 minute gets paid so much, but you and me will be still taken as some plumber or somebody who's doing so, something which is very difficult to compare. Within the system, first what we need to have, there should be an upper limit, lower limit, just like in the defenses. This is my concept. Every the soldier there, he gets much less than the general. If you ask me who is risking his life more, but the general has to be responsible for 1 lakh soldiers. Rather, that soldier is fighting at that time for himself and his limited area. So that is how it is looked after. So same thing, but why people still, medical profession is respected like the defense services are respected. You can put a limit, because these two are not comparable with a sportsman and an actor. You are a popular, it goes to billions of dollars. What did you get end of it? I do not know. If you ask me, is it essential? No. But everybody wants it. Let's not touch on that. Now, if you make it like defense, what is the benefit? They're assured of so many things. Family is assured of education, subsidized thing. That's how we can cut down the cost apart from the equipment. Put the thing, you say what is standard 15% profit, 20% profit, provided be very strict and vigilant. If you say something, if you put emergency for stroke, you should have this facility. Then you give him the first, give the government, give the facility. I'm telling you simple thing. Which hospital? I do not know. Very few hospitals with influential may have got places to build free of cost or at a concessional rate like many industries are being given today. Healthcare is very important. So we have only people who are interested in profit or investing. It's also a part of investment like any other industry. And part of it, I'm not telling totally non philanthropic, but the proportion is different.
So,
That's where we are facing the problem. Otherwise, if you had left it only for charity, it would have taken another 50 years to get what infrastructure we have today. They have done a great job.
or maybe
The
never.
private institutions. You took a decision that I want to have a clinic like this. You have done it
So that's precisely my point.
and set a standard. You have set a standard.
So I'm not differing from what you're saying, and nor am I wanting a comparison between cricketers and people in entertainment. All I was saying was that because there is a difference which is being recognized in every industry, that measure of that, like let's say, like you were saying, that private hospitals, uh, you understand their pain points, right? Because they pay the same taxes, they have the same rates to pay to the government and stuff like that. So my point was about people trying to recognize this is what is lacking, and the reason for that is because we in our own practices have not been transparent enough to create that clarity to our patients as to what is the infrastructure that is required, what is the minimum technology that is required, and what is the minimum level of expertise that is required. So imagine if you today are being, let's say you're working in one of the top hospitals in Bangalore. If you were compared and your hospital was compared to, like you were mentioning, some neighborhood nursing home, and you will find out that the neighborhood nursing home is also claiming what you are claiming, that is the difference that I was trying to bridge the gap.
See, I'll tell you like this. Somehow, uh, what you said is outwardly right, and also there are certain faulty lines within it. For instance, an idli, beautiful, tasty idli you can get for even today, maybe for a rupee on the roadside or any of the SLV joints in Bangalore. Same idli can be sold for some 200 rupees in a 5-star hotel,
Right.
right? So there you are paying for the ambience.
Correct.
So that cannot be straight away put in the medical practice.
It should never be.
So in terms of two things, like today, a new technique has come, new equipment I buy, okay, which makes it easier and faster recovery to the patient.
Right.
Say we say a lot of times nowadays minimally access, whether it is doing on the brain, nose or spine or stomach or heart, everywhere, means wherein trauma to the patient is reduced, the smaller scars and so on and so forth, and patient can leave the hospital early. Now the new equipment comes, the equipment company charges you a bomb. Why the hospital wants to buy? Not always, or the doctor wants you, not always because that is the best, but that is the latest. They want the latest. Okay, so I bought it at this cost so I can earn more money, I can attract more people.
Yeah, that's a very
That
wrong
attitude
approach.
should go. But who is going to bear the, if you ask in the bottom, oh, I've invested fresh money, I've learned extra time to learn, that answer is there should be a referral pattern, teamwork, and then you have to you can reduce the cost, no? In the sense, if I use by X method, open method, patient stays for 5 days, so much medicine is required, so much of hospitalization is required, so I will charge you the same, but you will get the less number of stays. That means hospital makes the profit, is not staying.
No,
So
but
some balance has to be struck. There are bodies which are fixing up the rates for insurances, etc., but I think they have to be more thorough and more open and considerations of how they fix the rate, because some of them, as you know, are ridiculous. When some insurance companies or reimbursements comes, when it doesn't even work out the cost of material you use. So
So let's look at it from a different lens. I get it from where you are coming, but let's just flip this lens of economics versus patient care. What I'm trying to focus on or bring to the foray is the fact that there is something that is minimum that has to be followed to do a certain thing.
yeah,
You cannot make tea without tea leaves.
agreed.
What you're trying to say is you don't need to buy the best organically grown tea leaves. You don't need to get a filtered water which is RO filtered from a particular brand, and you don't need organic sugar and organic milk to make the tea. That is expensive premium level, which is what is your 5-star hotel. You can get 10 rupee tea in a Darshini where somebody is making out of any brand tea, any milk, any water that is being used. Fair enough. My point is, in healthcare, I cannot not do certain things. So I'm talking about compromise. What I'm
Yeah.
trying to bring about is to provide a non-compromised care to our patient has a certain cost. But what is that cost is not transparent to
And
the
my answer
patient.
was to the previous question. If somebody is more expertise, more equipment, should he not charge more
No,
compared
no.
to a? I was answering that,
Yes. No,
not the
I,
next what you have brought out now. I was
yeah.
answering whether a difference in payment of an X star to the Y star of a movie or anything.
No, no, I
That
said,
cannot happen in medical. What I mean to say is, like it happens in an idli being served here to there, that much difference you cannot bring it in the thing which both of us agree. I only
yeah.
put it in different terms. The second component is, yes, that is what comes to the protocol. Somebody has to be guard. There are rules put up down the thing, and you know, if there are rules, people are ready to break it. Somebody has to be watchful. Most important, the person who is going to get the treatment should be aware of. That is where our
That's absolutely.
conversation is going to reach. So each area,
Exactly.
if we cover like that, what am I getting? Like today, somebody is going to get a car. How many of us are aware of it? Why we need a sunroof? You know, everybody is selling sunroof in India.
Yeah.
We are covering, running for shade. I got that sunroof extra. What are we going to do with it? So, like that, they should know, and that's what I'm thinking. It is the responsibility of all of us to bring out that aspect of healthcare, what is absolutely essential in this situation, that every level of doctor should be aware of. Like, for
Actually,
instance,
I feel the miss is in this word,
yes,
that what is absolutely essential. So, the mindset of most people is to think what is minimal requirement. Actually, that's not what actually healthcare should be focused on. What is absolutely essential should mean that this is the bare minimum standard of doing
correct,
something like this,
exactly, exactly.
right? But it should never be that I will compromise. Like,
No, it
unfortunately,
should never be linked to economics.
yeah.
Economics comes secondary. How am I going to bring? That's what I told you. How am I going to bring the cost down? This is an exercise that I feel our friends who are coming from management, they should come and look at that. Not instead of getting into which equipment I should use or which way patient should go early or what. If a patient deserves to be in the hospital care, he should be in the deserved hospital care. For instance, I tell you what we do. A lot of people send them off on this daycare. It's a big fad to reduce the insurance cost. But are we providing the home care?
But
Subsequently, follow-up care?
but
That should be inbuilt.
no, but I agree with you that management people should help us,
Yeah, in
but
that case, like
it should be like AI. AI is not going to replace the doctor. AI should help the doctor and
facilitators.
facilitate us, right? But unfortunately, today, all these corporate hospitals, the problem is because they are being led by management people who only understand how to make it more profitable, and looking only at economics is a dangerous situation for the doctor as well as for the patient. And that is the burden of disease that we are actually carrying today in this healthcare setups that we have in probably the country that we are suffering from.
I think I am very optimistic, as you know, always like you. I think the phase is going to wane off. You'll because a lot of MHAs are coming. Even MHA is not sufficient. I feel the merger has to happen. Should not be a doctor versus the
No,
management.
it's not.
No, I'm telling you. But right now, as you rightly said it, I have faced it. I have faced it a lot, but things are gradually changing. We are all working towards one thing. We are not working towards different thing because our connotations were different. Like a doctor is to get shocked if you say for square feet how much did you earn, per hour how much did you earn,
Yeah.
because that is the language they were taught. So somewhere the merger has to happen. So
Yeah.
overall outcomes. So many hospital, I have seen in my own, I should be say reasonably I am comfortable. For that, I should be strong first. We have proven to the hospital, they know the worth of it. Okay, don't calculate what average outcome I am going to give them, both in terms of reputation, both in terms of outcomes to the patient. All these analysis are being done fortunately now, and the costing, at what cost I'm able to deliver the best of thing, and how much profit he can make. So the clash is not happening. But initially it used to be irritating for us to listen to this kind of a thing. So the language, the perception of how a hospital has to be run is excellent. As you said, if they facilitate the burden of thinking of that, but we should be aware of, every doctor should be aware of economics.
Should be
Just
aware of
because,
not just economics. I think that's the easier thing to learn, but more importantly is integrity,
yeah,
because
that I said is the basis.
yeah.
You know clearly what you has to be done to the patient, what is their capability, what is the available facility, how
Yes.
I can get
And
it
that
done.
is where I was making that comparison with cricketers,
Yes,
that in one team, they know what is the capability of Virat Kohli versus MS Dhoni versus Rishabh Pant versus an R Ashwin. And when they come in, what is the value that they bring in, and what is the disability that each one of them bring in also. You cannot send in an R Ashwin to open the innings. So that is the differentiator that today neither the management or the managers of hospitals are seeing, nor the community is seeing. That was my point, that this awareness about healthcare practitioners and facilities is lacking, and that is where I bring this word transparency. The second thing is when we go out to work in some facility, right? Like you said, let's hope for this. I'm also optimistic that the wheel will change and there'll be more number of doctors. But when doctors come into leadership positions or decision making positions, at that point, do we make a compromise to save our position and seat, or do we draw a line and say this is the minimum that is required for us to provide good care and good facility to our patients? Or are we being cognizant of this fact that this will be a compromise and still go ahead and do it and still go ahead and charge? So it's not always true that if somebody is charging you X amount of money for a procedure versus somebody who's charging a higher amount, let's say Y, it's not always that the person who's charging more is making more profit, because
absolutely.
right, the person who's charging less can actually be making more profits. Like, I'm sure you've worked in many healthcare facilities and you'll actually be knowing this fact that not always an A tier hospital makes the maximum amount of money in terms of profitability, but actually B and C tier hospitals make more money probably, though they may be charging less.
Because their infrastructure needs are less. No, that's where we go back to the where we started, and probably we can conclude, because both of us are speaking the same truth in different language. The what I said is, first we evolved from a doctor centric or totally doctor driven, individual doctor driven healthcare to a system driven healthcare. We still remain the center point, who should continue to control the way and actually what is the treatment that is required.
Right.
And you should be the person to define, not like I'm giving you this, okay, this much table is only available with me. You put a 6 foot tall person and operate on this. No, that is the integrity comes. That should
Absolutely.
no compromise whatsoever. What is happening is in this competitive world, and I know to make it simple, you gave the examples of cricket and film stars. Ourselves, the people who are entering the profession, should never compare themselves outside this.
Oh,
If
yeah.
at all, I would say I compare it to a defense fellow,
Yeah.
because of the thing, and the hierarchy also, and the teamwork also. You know, or you take the help of somebody in the interest of the patient.
Yeah.
That is first. Then you stood by. I can boldly say, Srivas, as you know, probably you know it very well. I stood my ground from the day one, from my younger days to now. It cannot be, if something is no, that is not the way to be done.
Yeah.
Or I will move the patient to a place where the facility is available like that.
Exactly.
I might have lost in the short term something, but I am not unhappy because I didn't make the patient lose something.
Correct.
Getting away is no more acceptable.
Hmm.
After putting all the effort and available treatment options, facilities to a patient, still we may have bad outcomes. That is acceptable to me. Many patients come and ask me, how is it going to be completely all right? See, I will put my 100% effort, but I am not God. I pray God that your outcome is also 100%. I feel I am not boasting myself. Every doctor has to have that thing, then only this profession is going to be noble. It is going to be a tough time dealing with people who are investors, but they're also human beings. They understand, if I have survived, if I have done well, I feel fairly, I think everybody else can also. We can change their attitude, we can make them learn what it is. So it's primarily our duty. Definitely, people who are seniors, they should support the younger ones coming into the profession and spread the message across, make aware of the public who are going to be the ultimate, what I in not medical terms, in terms of the management, the clients, they should be aware of what they should get from where and why they are paying X amount of money. And for that, you rightly said, it's not just the pseudo advertisements. We need personal counselors in each of the hospitals and counseling who know actual truth and explain to the patient. I found nowadays most of them do accept why X procedure in X place costs so much. I think I'm fully in agreement with you. And why I wanted to break it in several pieces is because when a lay public listens to it, they take it individual. I know very, very much aware of that, what you are talking about and where you come from. But I always say that is multiple people are responsible.
Yeah.
It looks like one person is the villain. That is not the status.
Absolutely, Chief. So before we wind up, what is the difference between CT scan and MRI? And
Okay.
where do we do CT and where do we do
Yes.
MRI?
Okay. CT scan means computerized tomography. It is a specialized X-ray where we use X-ray in a certain algorithm, and there are multiple detectors. Like instead of one photograph, like you have your 3 cameras, there are 17 detectors, 16 detectors, 17 detectors, through which it goes round the body or whichever the organ, and it is able to delineate the structure much better, and we are able to see what an ordinary plain X-ray cannot show. But it is an X-ray, and it can be done faster, and it shows certain of the items better, that is the bone, and it can differentiate the bone and non-bone or calcified, non-calcified better, and certain moving parts better. Like a beating heart can be taken. We can do a coronary angiogram with a CT angiogram. We can do a brain angiogram using CT scan. But it uses tremendous amount of
Radiation.
radiation. So one should not, without proper indication, do it. But like ECG, in certain conditions, like if I have a transient neurological disturbance, least I might do is a brain scan. There, if it comes normal, good for the patient, we have to take the minimal radiation. MRI is actually, these principles of MRI were known much earlier than MR spectroscopy. Chemically it was used.
Correct.
It is a self-imaging, what I would call. I will not explain to you in detail. MRI is not uh, any kind of radiation. You are put under a powerful magnet uh, which is able to sense when certain frequencies of uh, radio frequencies are passed across. The structural changes that happen very, very, very minute, which is not going to affect our body, can be picked up, by which it is digitally analyzed and we get a true picture. Now, what is its effect on the body? So far, no side effect has been found. A CT scan and X-ray. X-ray can be, if cumulative dose, can be harmful. MRI can be done from the fetus to any age, a newborn. It is not going to alter. X-rays are avoided during fetal pregnancy, and as far as possible, younger age group, and repeated X-rays are avoided in others also. Whereas MRI is like taking photograph. If taking photograph of somebody, that too cold without flash, if it is going to affect you, that is why we frequently ask. But it's an equipment which is expensive, it takes longer duration. Somehow it has got a tremendous amount of noise, and most MRIs what we have today is a tunnel shaped, a cylindrical thing through which your body has to grow. If you have to make wider gantry, what we call opening, then you need to have more powerful magnet, more expense, more difficult to manage them. We are all having superconducting magnets they are, and you will get huge amount of data. As you know, the MR spectroscopy is measured in terms of Teslas. What we use ordinarily from anywhere 1.5 to up to 3 Tesla people we use, but there are MRI machines for research purpose available with up to 7 Teslas. They are not harmful. That noise, there's a movement of the magnets, and because they have to reflecting this RF energy, and sometimes they are provided with a mask, and it can image almost everything, and it is still an evolving science. So many times the different sequences are found added on every year, and what it means in terms of tissue, almost we reach in certain areas the pathological diagnosis. We can say this tumor is of this histological nature, and we can do functional MRI today, especially for the brain. It is something unimaginably, supportive of our diagnosis, what is happening to know in a live brain. People have done MRI controls in people who are meditating, who are in coma. Various data have come, and we are learning a lot, and they are using new, what we call sequences, through which different parts can be turned black into white, white into black, moving part into different things. Is a tremendous boon to mankind.
Great, Chief. So, on this, I think let's conclude our today's session. It was great information to speak with you on the stroke and what should be done at home, maybe at work, and how soon should we reach to people. I hope all of you listeners and viewers will find this extremely informative. Thank you so much for this, Chief.
I thank my audience first to having sat through our conversation. We might not have been able to, while covering the is a vast subject, we might have missed some points which you want to clarify. As usual, you can always write up to Scrub Guru, and we hope to meet you in person sometime or virtually. Have a conversation with you and clear your doubts. Thank you very much, Srivats, for your
Thanks, Chief.
invitation and engaging me in this conversation.
Always a
As
pleasure.
usual.
Thank you
Thank you.
very much. Thank you very much, Chief, for actually doing this great insightful discussion on the practice of medicine, economics of medicine, broadly touching on philosophy of care and stuff like that. That's a lot of insights that you have given us in this wonderful discussion, and we will have more detailed discussions on this as we go ahead and make things more interesting. Thank you once again, all the viewers, and thank you, Chief, once again.
Thank you for the day.
Thank you.